Today, we're tackling a really powerful question. Can something as fundamental as exercise during pregnancy actually help prevent postpartum depression? We're going to break down a fascinating new study that offers some pretty compelling answers. Answers that could, honestly, change how we approach maternal mental health. So, to really get why this research matters so much, we have to start with this number 1 in 5. Yup, that's what it means. 1 out of every 5 new mothers will struggle with postpartum depression. That makes it one of the most common and most serious complications of having a baby. It's a huge, huge challenge, and we desperately need better ways to tackle it. So first things first, let's make sure we're all on the same page. What exactly is postpartum depression? Okay, so PPD is not, and I mean not, just the baby blues. It's a serious medical condition. We're talking about a persistent, depressed mood, just crippling fatigue, and this thing called anhedonia, which is a clinical way of saying you lose the ability to feel pleasure in things you used to love. It's a heavy burden, and way too often it goes undiagnosed. Now, we have treatments that can help, like therapy and medication. But recently, researchers have started asking a different kind of question. What if we could prevent it? And could the key be something as simple as a healthy habit like exercise? And that brings us right to the heart of this study. This quote lays out the researchers' core idea, their hypothesis. They basically said, okay, what if we create a structured exercise program for pregnant women? Could that directly lower their chances of developing PPD after the baby is born? So that's exactly what they did. A team in Italy set up what's known as a randomized controlled trial, which is pretty much the gold standard in medical research, to try and find a real, solid answer. All right, so how in the world did they set this thing up to make sure the results were reliable? Let's get into the nitty-gritty of the study design. This chart here kind of gives us the roadmap. They started with over 500 women. Now, this is important. They screened out anyone with certain health risks or a prior history of psychiatric issues. That left them with 398 women who were having low-risk pregnancies. Then they randomly split them into 2 different groups. And here's the key difference. The first group, the exercise group, got a very specific, supervised workout plan. The other half, the control group, just got the normal, standard prenatal care with no special instructions about exercise. This setup is so important because it lets the researchers isolate the effect of the exercise itself. And listen, this wasn't some casual, hey, you should try to be more active suggestion. This was a serious, structured program. We're talking 3 one-hour sessions every single week. It started way back in the first trimester and went all the way to 35 weeks. And the program itself was really comprehensive. It had everything from cardio to pelvic floor work to stretching. So the experiment is done. All the data is collected. What did they find? Well, this is where the story gets really, really interesting. This is it, right? The big question. After all those months, did the workouts for one group actually change anything compared to the group that just got standard care? Oh yeah, it made a huge difference. The women in the exercise group had a 70% lower relative risk of developing significant symptoms of postpartum depression. Let that sink in. 70%. That is just a massive, massive drop. And this chart just lays it out so clearly. They measured symptoms using a standard tool called the Edinburgh Postnatal Depression Scale, or EPDS. A score of 12 or more is a red flag for significant depressive symptoms. Now look at this. In the control group, over 20%, 1 in 5, hit that mark. But in the exercise group, just 6%. The difference is stark. And if you look at the table, the effect was consistent no matter how they slice the data. Whether they used that higher cutoff score, a lower one, or even just looked at the average depression score for each group, the exercise group did way, way better every single time. Their average score was a full 2 points lower, which is a big deal. Okay, so the results are pretty remarkable, but why? What's actually going on here? And what's the bigger takeaway? Well, the researchers think there are a few things at play, both in the body and in the mind. Biologically, exercise is famous for releasing those feel-good chemicals, the beta endorphins. It can also boost key neurotransmitters and this really important protein for brain health called BDNF. But then there's the psychological side. Sticking to a routine can make you feel more capable, it can help you sleep better, and it can lower stress. It's really a win-win-win. You know, other studies on this topic have had kind of mixed results, so why did this one work so well? The researchers think it's because 1, their program started really early in the pregnancy, 2, it was very structured and supervised, and 3, they were looking specifically at a low-risk group of women. Now, of course, good science means being honest about the limitations. This was an open-label trial, which just means the women knew if they were in the exercise group or not, and that knowledge alone can sometimes have an effect. It was also done at just one hospital in Italy, so we'd need to see if the results hold up elsewhere. And maybe most importantly, this was for low-risk women. We don't know if this would work for women with a history of depression. But even with those caveats, this study points to something incredibly hopeful. It suggests that a safe, structured exercise program could be a powerful, non-pharmaceutical tool for protecting the mental health of new mothers. And it leaves us with a really provocative question. Is it time we start thinking about prescribing movement as a standard, fundamental part of prenatal care?